We will talk about the diseases of the respiratory system. One of these diseases is the influenza. It is caused by a virus that affects the nose, throat, bronchial tubes, and also lungs. The symptoms are more severe than the common cold. It is very contagious. There are three types of influenza: A, B, and C. In 1918, there was a worldwide epidemic which killed about 50 million people caused by influenza type A. Also, in 2009 in Mexico, it was an epidemic of one type of influenza called A1N1, which killed many people.
Some other diseases of the respiratory system are asthma, bronchitis, emphysema, and lung cancer. Asthma is a disease similar to an allergy which can cause an attack when inhaling the allergen. Asthma attacks are characterized by contractions of the smooth muscle of bronchioles, which reduce the ability to pass air in and out alveoli, and breathing is very difficult. The treatment for asthma are very varied. It can be anti-inflammatory and bronchodilator, asthma inhalers, and also oral medications and drugs in nebulizers.
Emphysema is a respiratory disease which is chronic. It is characterized by an inflation of the alveoli, causing a decrease in the function of the lungs. The main cause of emphysema is smoking, which stimulates inflammatory cells in the lungs, leading to swelling within the bronchioles. Emphysema cannot be cured, but some treatments can be made to reduce symptoms and slow the growth of the disease. These treatments include bronchodilators, antibiotics in some cases, pulmonary rehabilitation, and in extreme cases, surgery to make lung transplants.
I'm Ricardo Guillen and I'm going to talk about bronchitis. The bronchitis make a connection between the windpipe and the lungs. Bronchitis reduces the quantity of air and oxygen that flow to the lungs, and it can cause big amount of mucus that form in the airways. One type of bronchitis is the acute bronchitis. The treatment for bronchitis is based on reducing symptoms and relieving breathing. Acute bronchitis can be treated with resting, drinking fluids, and in some cases, antibiotics.
Prevention for influenza includes immunization, which provides good protection. You get immunization with an injection of a vaccine against the virus, which is given each fall. Asthma can be prevented by avoiding smoking and exposure to situations that cause allergy symptoms, and also by taking your medication as prescribed. Bronchitis can be prevented by avoiding smoking, get vaccinated, avoiding exposure to air pollution, and also washing your hands. Finally, to prevent emphysema, also avoid smoking and avoiding exposure to air pollution or any kind of dust.